Welcome back, everybody. This Week in America. Glad you're with us on the program today. Dr. Richard Roach is an associate professor at Western Michigan University, Homer Stryker School of Medicine, where he teaches internal medicine, global health, and tropical medicine. He's worked extensively in Africa and Madagascar, treating and interviewing patients with complex social and medical challenges. He's written a book on tropical medicine as well as articles on internal medicine. Dr. Roach is the author of 3 novels, Saving Skunk, Releasing Lisa, and the book we'll be talking about on today's This Week in America, Never a Woman. A story about the power of the human spirit as a Kenyan teenager attempts to overcome seemingly insurmountable anguish in order to find love, success, and joy. The book tackles important issues like female genital mutilation, human trafficking, and tribal prejudice. The author of Never a Woman, Dr. Richard Roach, is with us on This Week in America. Dr. Roach, welcome to the program. It's great to have you with us today.
Thank you very much for the invitation.
This is such an important book, and let's talk about, first of all, why you were drawn to Africa. You've been there a number of times. This is very, very important to you. Why Africa, and why these particular issues? Why are you calling attention to these at this time?
I was drawn to Africa because of opportunities to work with some of my partners from Berrien Springs. They basically started hospitals in Kenya, Sierra Leone, and Rwanda. And so they asked me to join them. And basically I fell in love with the people that lived there.
And you do an excellent job in capturing the spirit of the people. I mentioned the teenager that you follow during the course of the book. And the name of the book, again, is Never a Woman. Dr. Richard Roach, our guest on the program. His website is authorrichardroach.wordpress.com. Book's available at Amazon, Barnes & Noble. You can link on directly by going to our website, thisweekinamerica.us. Tell us a little bit about the teenager in the book, and then as her story progresses in the book, we'll talk about some of the various issues. Talk about her, because you can't help but falling in love with her and really admire her spirit.
Yes, the main character is Kwamboka, and that her name means the one who crosses the river. And that is a name that was given to her by her mother because she's a very spirited young woman. And the problem with the book is that she refuses to have female genital mutilation, and as a result she becomes ostracized by her tribe, because if she doesn't go through a ritual, then she will never become a woman from her cultural standpoint. And so that's where the title of the book comes from.
Talk about the importance of that in that society there, because as you say, if you don't do it, you're basically ostracized. In the book, Never a Woman, she's in a fire. Her uncle is sort of taking care of her, yet he basically says you're worthless because you've never gone through the surgery.
Right. So actually, Lancet has done research on the cultural reasons why different cultures require female genital mutilation. The Kisii tribe, which is the one that's highlighted in this fictional novel, they do female genital mutilation because it's part of puberty rites, and it means the passage of being a young girl to becoming a woman and being marriageable and having the rights and privileges of a woman.
The book is called Never a Woman. Dr. Richard Roach, our guest on the program. In the book, she talks about her mother wouldn't let her get circumcised. Her friends went through the ceremony to become women. She had a best friend that died of infection. In real life, you've gone there to work on surgeries, and you've dealt with the trauma that some of these young women have gone through. Talk about that, because this is a very difficult, obviously a very difficult set of circumstances for them to go through.
Yes. It is well documented that some of these young girls end up dying of infection. Some of them get tetanus because the instruments used to do the mutilation tends to be a sharp stone that's been passed on from generation to generation. And that's part of the historical heritage that these women go through, because this is something that has been passed down as a privilege to these in this culture. So then when they go through the puberty ritual, usually an older woman is the one responsible for doing the mutilation. And then when they survive, then they are marriageable, and then they are truly a woman as far as that culture is concerned.
And a number of the women there shared their stories as you have been there and working. And you're talking about what this is a very complex surgery, so you basically assist the doctors there.
Yes, I have worked in Rwanda and Kenya and been available to help assist in the surgery to do the repairs. Part of the problem is that if these women first have sexual intercourse, there's a tearing of their female organs. If they get pregnant, then oftentimes there's a delay in delivery, and the head of the baby crushes the tissues of the vagina, and so they get a fistula forming between the bladder and their vagina. So they're leaking urine out their vagina. As a result, we have to go in and repair that, and you have to put a tissue between the bladder wall when you sew up the hole, and then you have to sew up the vaginal wall, and that tissue that you put in between has to have a good blood supply so that the fistula doesn't form again. So this is a really serious problem, because when these women leak urine out their vagina, then their husband usually abandons them, and they become a non-person in society.
Are we making any progress in eliminating this or cutting back? You've been there a number of times. Do you see any progress is being made so that they understand this is a very painful procedure to go through and can be a deadly procedure?
Correct. Both Uganda and Kenya and Rwanda have outlawed the procedure from a government perspective, but as noticed in the novel, Kwamboka's uncle says, well, that's Kenyan law. Our law from Kisii culture goes back way far into the past, and we practice Kisii law, and Kenyan law doesn't supervent that. And so this is a cultural problem.
Yes.
Even though in the countries I've mentioned it is an outlawed procedure.
It's interesting in the book is Never a Woman. You mentioned it's a novel. It is all based on extensive research. A lot of what you've seen firsthand over there, it's incredibly accurate from everything that I've read. And Kwamboka is basically and orphan, her uncle is looking out for her, and they have a marriage process over there. Leverate, is that how you pronounce that? Explain what that
leverate.
is. Leverate.
And what that means is that when Kwamboka's father dies, then his closest male relative is culturally responsible for Kwamboka's mother and for her. What often happens, though, as outlined in February 2017 National Geographic, is that the relative grabs the land and literally makes the person homeless. In the case of the story, Kwamboka's mother refuses to marry the uncle as his fourth wife, and as a result, the uncle has her murdered, and then he tries to confiscate the fields. And because Kwamboka didn't go through the ritual, then he tries to kill her. So instead of being a protector, ends up trying to murder Kwamboka.
Our guest on the program is Dr. Richard Roach. The book is Never a Woman. His website is authorrichardroach.wordpress.com. Of course, you can go to our website, thisweekinamerica.us, and link on directly. The book's available at Amazon and the usual places there as well. So Kwamboka is an orphan. She decided. Now let's talk about that. Her father, mentioned, died. He died of AIDS. The mother was basically murdered by the uncle. Talk about the problem of AIDS there, because this is something else, an issue that's very close to your heart. That you've seen the devastation of the disease.
Yes, when I was working at Kibagora Hospital, the hospital that's actually mentioned in the book, of all the patients in the hospital, it's about a 300-bed hospital. Half the patients were HIV positive. An interesting study was done at the border of Kenya and Uganda, in which truck drivers were tested. They didn't get a choice. If you're going to cross the border, you had to have a blood test. And what they discovered was that 30% of the truck drivers were HIV positive. So that's why I put the story of her father being a truck driver into the novel. Her mother, on the other hand, since she refuses to marry the uncle, then the uncle pays a sorcerer to decide that she's a witch. And if you take a look at the Kisii website that is available online, you'll see the news reports that in Kisii culture, witches are still often killed, burned, macheted to death. And so that's how the uncle arranges to have Kwamboka's mother killed.
And Kwamboka goes to Nairobi. She's off on her own, has no idea what she's getting into as she's taking off to go to Nairobi, to go to the university. Interesting, she sort of follows the road that her dad took as the truck driver in going there. Along there, she's got a number of challenges on the way there. She meets a character referred to as Mother Joyce that basically takes her in and looks after her, cares for her. Talk about that character to understand it's sort of symbolic of what happens in that country.
Yes. First of all, it's important for your listeners to know that if a student scores very high in the national exam, for example, you have to be in the top 5% of the national exam, then you get a scholarship to go to Nairobi University for free. So because Kwamboka scored so high, that gives her the privilege to go to Nairobi University tuition free. The problem is getting there. And so as the novel progresses, she meets Joyce. And the interesting thing in Kenyan culture is if a woman is unable to have children, oftentimes she gets divorced because she's unable to bear children for her husband. Then they often adopt an orphan, and that orphan literally becomes their child. And they take care of them as if they're their child. And it was very interesting when I was working there because I was often introduced to the mother of a patient and then to find out that they weren't even biologically related. But it was because this woman had taken compassion on this person and literally adopted them as their child. So this is not an uncommon phenomenon in a culture where women who can't conceive are cast away. In Joyce's case, she has the ability as a seamstress, and so she can make her own money. And oftentimes that's what happens is these women end up marketing some skill in order to survive, in order to make money, and then they adopt a child so that they have someone to help take care of them. That's like their social security when they get older.
It's interesting because you take another really important issue and weave it into the novel, Never a Woman, and that is the problem of tribalism in Kenya. There's a story in the book where there's a visiting professor at the University of Nairobi from Boston College, and he's saying tribalism is so destructive in this country. And you know that firsthand, and it's something that you talk about in the novel. Talk about that in real life, the problem of tribalism there.
Uh, the problem is that the majority tribe in Kenya is a Kikuyu. Kenyatta, the first president, was Kikuyu. And so the Kikuyu being the dominant tribe and the first president being Kikuyu means that they feel that Kikuyu should have preference in governing the country. So poor Kwamboka is Kisii. She's from a very small tribe in southwestern Kenya. And so what you see, even in the big city in Nairobi, is that there is a lot of tribal prejudice. If you're not from the right tribe, then you shouldn't have the privileges of the ruling tribe. So this is a problem. It's a problem both in education, it's a problem in hiring people for jobs, and it's certainly a problem in terms of government employment.
It's interesting. You worked very closely there with the Rwandan team. You had a housekeeper, cook, and nurse translator, and you had the Holocaust, Rwandan Holocaust there. Talk about that and the impact that left on you and your family.
Yes, the fact of Kwamboka getting into the sex trade and escaping, that story was actually a story of a young woman who that I met while we were working in Rwanda. I really loved working there. I was in charge of the malnutrition ward, and I was also in charge of the tuberculosis patients and worked there for 3.5 months. We just really fell in love with the people. I brought my wife and my 2 children, and it was just a rich, wonderful experience. Uh, 5 years later, the Holocaust occurred, and we were devastated because our housekeeper was one of the first people killed in the Holocaust. She was a youth worker at the church, and she was lined up with some of the other officials from the church along the wall of the church and machine gunned to death. Our cook, Bizimana, actually had a boat. And so when the rebels came and found out that he had a boat, they were worried that he would escape the country and go across Lake Kivu and enter Congo. So they macheted him to death in front of his wife. So we were really devastated when we got the news that these people that were so important to us when we had worked there had died as a result of the Holocaust. Also, my nurse who translated Kinyarwanda, since I didn't speak Kinyarwanda while I was there, she worked with me for every patient and translated for me, and she also was killed in the Holocaust. So our whole family was devastated by that experience.
With us on This Week in America, a couple minutes left in the program, is Dr. Richard Roach. His website is author Richard Roach, ROACH.wordpress.com. The book is Never a Woman. It's available at Amazon. Information at Dr. Roach's website. You can go to our website, thisweekinamerica.us, and link on directly. Just in wrapping up, Kwamboka's spirit is just, it's so inspiring. Talk a little bit about that, and I would think it would be difficult to leave a character like that behind, such an important and strong character.
Kwamboka just never gives up.
Well, that's for sure.
So even when she has to walk across the Masai Mara Valley, she ends up fainting in exhaustion. people come at the right time to rescue her. She goes through the experience of graduating from Nairobi University, despite all the problems. And then she ends up marrying the professor from Boston College. And when she finally arrives in the United States, has to deal with his mother that hates African people. So, yeah, she is a very amazing woman who just keeps on loving her mother-in-law and literally loves her to the point where her mother-in-law totally changes her mind about African people. So this was a character that I fell in love with her character, and basically, as other authors may have told you, the character tells you what they're going to do next,
Exactly.
what they're going to say. And this is such a lovely young lady that she literally did that for me.
The book we're talking about is called Never a Woman. The author is Dr. Richard Roach. The website is authorrichardroach.wordpress.com. The book's available at Amazon, Barnes & Noble. Go to our website and you can link on directly to get information on the book. Doctor, it's been a pleasure to have you on the program. It really is an inspiring book and talks about some real-life problems that we all need to be aware of and attempt to address in our own ways. Thank you so much for being with us on the program.
You are very welcome. It's been a delight.
With us on the show, Dr. Richard Roach, author of the book Never a Woman, other novels written by Dr. Roach, Saving Skunk and Releasing Lisa. All the information, of course, at our website, thisweekinamerica.us. We're back after these messages.